Hi, this is Sally Frings. This is the second time that I am going to record this because I ran over the 15 minutes the first time. I am here to present to you tonight Professor Tracy Town, the residency hours that I've achieved in 835 at Edgewood College, and here we go. So I want to acknowledge that Carol Walther is and has been my residency preceptor. She is the VP of Primary Care and Population Health at UW Hospital and UW Health. My compilation of hours, I just want to start that prior to nursing 835 residency and when I began my DNP program, as I think it Alicia and I said that we were encouraged to document all of our conferences and CEUs that we had achieved. I did track 136 hours from the end of 2019 up until August when we started our formal semester. And those are in majority conferences that I attended. There's one actually, but they're up at the top. There was a 12-week program called UW Health Way where I achieved CEUs for that. And that has to do with quality improvement, continuous improvement, and management systems, as well as other topics such as respect for people. And it's a very foundational, mission-driven program at UW Health. So that was great. Also, of note here, I was in attendance at the Magnet Conference the year, so it's last October in 2019 when UW Hospital achieved redesignation. And some other just cross-functional survey-related work with process improvement that I was able to work on and was assigned by Carol Walther to do that atypical add-on work, knowing that my residency program would be coming. And then I have my city IRB nursing contact hours for the human subjects research and basic course that are required for the capstone. So I have credit for that as well. So I do have those logged in under conferences and CEUs in the Typhon platform. There's three main buckets of hours that I compile during Nursing 835 in this fall. I have 269 hours that Carol precepted, which is a mix of category 2 and 3. I did hope to achieve 350 hours. I have almost an 80-hour shortfall in that. However, the good news is I believe I will be having the 75 hours from Capstone Project as well as the 30 hours from your residency course added into Typhon as well. So I should have from this semester alone 374 hours. If you add those up as you see below, that has, in addition to the category 2 conferences and CEUs that I achieved prior to the beginning of the fall, I should be sitting at 510 hours total with 490 remaining. And I did not come into this course with any CEUs from my master's program. Those, as broken down into DNP essentials, are essential 1 is 22%, essential 2 is 53%, which makes a lot of sense because I was able to focus those in the semester or prior to this semester, and a lot of those conference hours really kind of boosted that up. And essential 3 was 26%. I do feel like I'm fairly well balanced there. And you can see here the overall hour breakdown in the bottom table. There was 4 major areas of focus for my fall residency, that of system leadership in the incident command structure at UW Health. Also, Carol was able to grant me the opportunity to lead a system project that is related to respiratory cohorting. I also have a fairly significant amount of opportunity to do some very focused residency work towards quality improvement training, support, and rounding. So I'll talk a little bit about that. And also Carol's wheelhouse, which is not mine, but has been fascinating, is population health initiatives and working through chronic disease and health maintenance work and developing tools and working closely with informaticists and our Epic team to build out some really great things there. So I'll just touch real quick. I'm going to watch the time here as well on each of those categories. So system leadership and incident command, Carol put me up to the plate to become operations chief at the incident command structure. That was a little bit more than I had bargained for. And I think also part of the reason, not only was it a great opportunity, but every fifth week for the last several months, I have, not several months, but for a good amount of time, have been pulled out of my normal day-to-day duties and have served on the incident command structure. The exciting thing about this is during a crisis and when there is a health system incident command structure stood up, usually it's the incident commander that is leading that, but in a pandemic, it's for sure the medical branch officer who is really leading that crisis response. So as operations chief, I was able to work with 4 of the top physician leaders in the organization, Pete Newcomer, Matt Anderson, Jeff Potoff, and I'm going to think about who the other one is, Amy Becker. All chief medical officers or senior medical officers or higher. So that's been an extraordinary opportunity. I will not say that it's been easy in any way. It has been physically grueling. And then to come off that and to go back to the normal day-to-day operation of my job that has not slowed down during the time that I was every fifth week in incident command was hefty. But again, a great experience, and have touched every discipline in this health system, and I feel built some great relationships and partnerships across the way. Of note, I was also able to work with our partners in Rockford and Swedish American, that is a part of UW Health, as well as those partners in our joint operating agreement, UPH Meritor. And I'm really proud of the work that we were able to do, or I was able to facilitate with Meritor. I don't think some years ago everybody would have believed that UW Health and UPH Meritor would be working so closely together. So that's great. The other big thing that was gifted from some learning and opportunity by Carol was to lead the system respiratory cohorting. To be fair, Carol was ultimately responsible for this huge work stream that was developed really at the beginning of the residency starting. So I was involved in several hours of meetings leading that, reporting back to Carol, working hand in hand, reporting up and cascading information across the system, again with Swedish American and Meritor to keep them apprised of what UW Health was doing. So I had some really tremendous opportunity there. And I think it's been very, very successful to this point. Would love to talk about that more, but don't have a ton of time. Quality improvement training, support, and rounding. That focus is near and dear to Carol's heart. She is a huge proponent and pioneer of the UW Health Way, as I spoke about before. And a good share also of the residency that I have been focused on is training and doing significant amount of rounding with multiple different cohorts, as well as across different teams and functions. One of the great, I think, opportunities that has come out of this is we're looking at surveys as a source of outcome data. Such as patient satisfaction surveys, safety surveys across the system, NDN-QNI, which is the nurse quality metric, and nursing satisfaction surveys. And this cross-functional group that I have been asked to serve on for the residency is looking to find similarities in A3 type work that can hopefully tie out to improving the outcomes of the surveys, which would, of course, show that we are finding improvement in satisfaction of patients, staff, and also the belief that our organization is safe in our safety surveys. So that is something quite extraordinary. And last but not least, something that is definitely not in my typical day-to-day wheelhouse, but certainly is in Carol's in her VP role, is population health initiatives. And there was quite a large initiative that I got the opportunity to actually lead. Carol handed the reins over to me as the residency started for development of tools that are used by primary care physicians, which is in my wheelhouse, but not working with the different informaticists and HealthLink team members to create rules and regulations, and tying out to different policy, as well as looking at our quality scores and outcomes at a higher level to the government, and trying to find ways to integrate tools and put them in the provider and clinical staff hands that can be utilized during a rooming process or during a regular visit to understand if patients have had all of their preventative care, and as they do have chronic disease, set cadences and timers, and develop tools to have number one reminders or ticklers that, hey, Sally hasn't had her, mammogram, and she's over the age of needing a mammogram, or something that is a timely thing like diabetic management. How often do we need a hemoglobin A1C, or something like even AAA assessment for abdominal aortic aneurysms. And if I'm a certain age and a demographic, is caught and it's understood automatically by the medical record, and can fire a reminder that, hey, Sally is of X, Y, or Z age, and she's got a history of smoking, and she has cardiovascular disease. She should really have a AAA screen, and that would fire. So that's very interesting, something that has been really fun to understand and look at data and prioritize those initiatives and what tools should be developed first and put into pilot. So we are just moving forward into pilots on that, and it will be fun to continue to watch that carry on. And depending on next steps with residency, that may be something that I get to continue to follow. So all of that being said, I am 510 hours under my belt with 490 to go. And there goes my alarm. I have 2 minutes left. As far as learning this semester, I have to say it has been a trying semester, also with working on my capstone, which has been a huge lift, very exciting as well. My capstone is focused on primary care access and supporting patients with having frictionless access to their providers, and looking at schedule standardization for that. So I know I do get to obtain some credit for that work. So I'm really excited for the next chapter and getting the data for my project for that over the next couple months, and then working to finalize my manuscript and capstone. So that's my report out. I am thankful for your support and the reflections. I also wish I have had more time with my reflections. I actually have to finalize my last reflection for submission for one of the weeks that I have been in residency, and that is it. I'm going to call it a day, and thank you very much. Have a great holiday, and I look forward to your feedback.